Environmental Change and Public Health at London School of Hygiene and Tropical Medicine with a joint appointment in the Department of Public Health, Environments and Society and the Department of Population Health. His recent research has been on the effects of environmental change on health and the impact of policies to adapt to or mitigate these changes. Currently, Professor Haines chair the Inter-Academy Partnership Working Group on Climate Change and Health, the Royal Society and Academy of Medical Sciences Group on Health and Climate Change Mitigation, and the Lancet Pathfinder Commission on Health in the Zero Carbon Economy, along with participating in the Lancet Commission on Pollution. We are honored to have Professor Haines with us today, and I invite you to listen and engage with him. Over to you, Professor Haines.
Well, thank you very much for the kind introduction, and also to Claudia for inviting me to speak. I thought what I would do is to give you a kind of overview of this concept of planetary health, and really not try to be comprehensive, because it is potentially a very large subject, and we could have whole several-day conferences discussing all the different issues that it raises, but more to make a few overarching comments and to invite your responses and questions so that we can have an interactive session. So I'm going to base what I say on two publications that I've been involved with. One was the Commission on Planetary Health, the Rockefeller Lancet, which was published back in 2015 now, so some years ago. It was a very interesting experience for me. It involved working with colleagues from many different countries, different disciplines, and so on. And we were given the task of looking at summarizing the evidence, linking a global environmental change and human health, which has been a relatively neglected subject. I mean, there has been growing interest in climate change and health over the last 15 years or so. But looking at this bigger picture of planetary health has been rather neglected. And more recently, in 2021, myself together with my colleague Howie Frumpkin wrote this book called Planetary Health, which was an attempt to bring together, update some of the evidence that we got from the Rockefeller Foundation report, which, by the way, you can just download from the Lancet website, and explore some other issues that we didn't have space to explore in the Rockefeller Lancet report. So that's the sort of basis of what I'm going to be talking about. And of course, it is intensely multisectoral. So the focus is health. Of course, it requires insights from different disciplines, different perspectives, different sectors in order to make sense of this bigger picture. And I should say that the term planetary health has been used in different ways. So some people, when they talk about planetary health, they really think about the health or the state of natural systems of our planet. But the approach we took was that human health was inextricably linked to the health of natural systems, to the state of natural systems. So we saw it as a kind of integrated concept, which included human health, but within planetary boundaries. And we used this framing that was first proposed by Rockstrom and colleagues in 2009, and then it was updated by Stefan, by the late Georgina Mace, who was a wonderful biodiversity scientist, by Rockstrom and others, in 2015. And this is the most recent diagram I could find, which summarizes the planetary boundaries and the state of them. And what you can see is that the concept really is that humanity exists and can flourish within what they call a safe operating space. So, we live on a small planet. We're producing vast amounts of pollution. We're changing natural systems at an incredible rate. Of course, we've benefited overall, but very inequitably, from human progress. So we've seen a dramatic decline in infant mortality, in even maternal mortality. We've seen an increase in life expectancy of well over 20 years since the middle of the last century. But all of that has come at a cost, and the cost has been borne, of course, by the Earth systems, by the systems which ultimately underpin our civilization and our health. And what this slide shows you is the different planetary boundaries. And you can see that many of them are already in the kind of orange to red area, which means that we're either at the boundary, beyond the boundary. You can see that that's true for biosphere integrity, for land system change. We're degrading land to grow food largely for a growing world population. The biogeochemical flows refers to phosphorus and nitrogen, but of course are overused, particularly in high-income countries to produce food. We have this category of what they called novel entities, which essentially is the thousands of compounds that are released into the environment, often without fully understanding the impacts on human health or understanding how they interact with each other. And then there are others that are we're more familiar with, like stratospheric ozone depletion, which is a kind of partial success story because of the Montreal Protocol did limit the use of ozone depleting chemicals, although there's some illegal use, but it's a kind of qualified success story. But most of the others, of course, are going completely in the wrong direction. And these effects are undermining human health, and they will increasingly undermine human health in the future. There's still a lot we don't understand about them, about the impacts, and particularly how they interact with each other. But we know enough to be very, very concerned. So let me just focus a bit on climate change and health, because it's an area which I've been concerned about for many decades, really. But the evidence is growing pretty rapidly on climate change and health. It's been a neglected topic. It's been neglected by the research community, by research funders, by policymakers, and so on. But it is now getting a little bit more attention, which obviously it deserves. So on the left side of the slide, you can see the difference between the temperature, the global average temperature, that's the orange line, that we would have been experiencing if we hadn't seen a massive increase in greenhouse gas emissions. And you can see that it goes up and down, there's natural fluctuation, but it remains relatively constant. Then the red line shows you what's actually happening. So what's the temperature that's being observed? And you can see that the two lines are diverging. So we're now over 1.1 degrees difference between the natural variability and the increase in temperature caused by human-induced climate change. Now, that's a global average. Of course, the temperature increase is greater over the land and over the oceans. It is greater than over some parts of the planet than others. So the Arctic is heating up 4 times more quickly than, than other parts of the planet. So it's not a homogeneous process. It's quite heterogeneous. And on the right side, you can see the situation in the first half of 2020, and you can see that massive kind of heat area over the Arctic and over Siberia. And it's just one example of an event which wouldn't have occurred in the absence of climate change. So that was the Siberian heat and fires. That would have been virtually impossible in a pre-1900 climate. But we know that it happened, and so we can confidently ascribe it to climate change itself. And this is a really important point, because in the past, we've often talked rather generally about the health effects of climate. So we've talked about the fact that, increasing heat, that during heat waves, people die, obviously, particularly elderly people, but not just elderly people. But only in recent years, we've been actually be able to attribute those deaths to climate change rather than natural climate variability. And that's an area which is now quite expanding. There are a few studies, not enough studies, but there are a few which have actually quantified the contribution of human-induced climate change to human health impacts. So how does climate change impact on human health? Well, I'm not sure if you can see all of that slide, but at the top, you've got the greenhouse gas emissions. That's carbon dioxide, obviously long-lived greenhouse gas. A proportion of it stays up in the atmosphere for over 100 years. So it's a kind of legacy that we're leaving future generations, but also the short-lived climate pollutants like methane, which stays up for 12 years, and others like black carbon, which stays up just for a few days or weeks at the most. And this is causing climate change, which increases the risk of extreme weather events, obviously heat waves, wildfires, and so on. As you heat up the oceans, of course, sea level rise occurs, and that will be amplified. For example, if the West Antarctic ice sheet collapses, then that would obviously greatly increase the risk of sea level rise. And through a range of different demographic, socioeconomic, and other environmental factors, the climate change influences the magnitude and pattern of risks. So it's a kind of risk multiplier, if you like. And the exposure pathways are shown in the middle of the infographic. And you can see that there are a range of them, all of which have different effects on human health. So we start off with the most obvious ones that you're particularly concerned with, I guess, like extreme weather events, floods, droughts, wildfires, heat waves. Heat stress itself obviously has an effect on mortality, on death rates. but also prevents people working. So as you heat up the atmosphere, it becomes progressively more difficult to work. And that means that there's a decline in labor productivity, forcing more people back into poverty, and so on. Then we can see also air quality. Wildfires are one example of that. So wildfires produce a large amount of toxic pollution, fine particles which get very deep into the lungs and increase the risk of heart attack and stroke, particularly in the few days following wildfire smoke exposure. Then we have effects on water quality and quantity because of changes in rainfall patterns, of drought, for example, in some parts of the world, and flooding, of course, in other parts of the world, sometimes even coexisting in the same region. And these both have important implications for health. Drought, obviously, by reducing food, crop yield, and increasing undernutrition. Floods by causing direct injuries, but also affecting mental health, and I'll mention that in just a moment. Food supply and safety, obviously a very important mechanism. So as you increase the CO2 level in the atmosphere, you actually decrease the nutritional quality of crops. So you get reduced iron, reduced zinc. These are important micronutrients for human health. So although it does stimulate the growth of some types of crops, it also decreases their nutrient quality. But climate change itself has direct effects on reducing the yield of crops through changes in rainfall, increasing heat, for example, and sometimes increases in pollution as well. So really quite pervasive effects on the food system. And of course, the food system is also a very, very big driver of environmental change. So it contributes about 25% of greenhouse gas emissions from ruminants, for example, methane, or from deforestation, but also, of course, is a major driver of biodiversity loss, for example, which is another planetary boundary. So these greenhouse gas emissions are coming from the energy system, about 3/4, and the food system, and obviously impacting on food supply and safety. Then we have vector-borne diseases. Well, diseases like malaria, which particularly the edges of its distribution, where it's limited by altitude, for example, parts of East Africa or Colombia, for example. You see this evidence of malaria sort of going up the mountains, if you like. And also dengue, which is the commonest vector-borne disease globally. Again, we're now seeing shifts in dengue distribution and transmission, just to give two examples. And on the right side of the infographic, you can see that there are also very big impacts through social factors. I've mentioned increasing poverty, for example, probably violent conflict, forced migration is a big issue and likely to get much bigger in the future, depending, of course, on the decisions that we made. And then, of course, one of the important messages, which you'll, I think, be broadly familiar with, is there's this massive overarching issue of climate injustice. So the top 10% of emitters, which include many of us in high-income countries, are responsible for nearly 50% of emissions. A recent update of this is in Nature Sustainability. So clearly, climate injustice is really at the heart of this whole debate. And those who are least responsible for emissions are often the most affected. So this is just some work we did a few years ago, looking at the likely effects of increasing heat on labor productivity. And if you look at the right side of the slide, you can see the yellow area on the map. And you can see that that's the area of really extreme heat exposure in the hottest month, where it makes it really hazardous to work. Even moderate physical activity becomes hazardous. And you can see how that yellow area expands as the global average temperature goes up. So as you get over, say, the latter part of this century, depending on the decisions we take over coming years, we could see 1 billion people being located in areas where it's really hazardous to work during at least the hottest months of the year, and possibly more. So those people will be unable to follow their livelihoods, and as I've mentioned before, will be forced back into poverty or prevented from escaping from poverty. And then most recently, we've just published some interesting work, which we think is interesting. It's based on actual field studies in West Africa with pregnant women subsistence farmers. And this is being undertaken with our colleagues in the Gambia. And it involves going out with pregnant women subsistence farm, measuring the heat exposure using something called a wet bulb globe temperature meter, and also measuring what's happening to the fetus in these women. And what we're finding, and it's very worrying actually, is that at the end of a working shift, the fetal heart rate goes up. It goes up in proportion to the amount of heat that the pregnant subsistence farmers are exposed to. And a significant proportion of these, it gets into the range which suggests that the fetus is actually showing evidence of fetal stress. So this is very worrying, and makes me think that many of these women are actually already at the kind of limits what's possible, physiologically possible to adapt to. So our next phase of work, of course, is going to be working with some of these communities to see if we can devise strategies which will help them to work more safely. But of course, they don't have really a choice because they're trying to feed their families. So this is a really worrying finding. And I was surprised at the level of heat stress that they're exposed to, actually. And if you're interested, you can just download that paper from, or both these papers. You can just, it's an open access journal, so you can just download them. And then the other question I raised was, well, rather than talking just generally about kind of heat, what proportion of these effects can we attribute to climate change rather than just natural fluctuation? And this is a study led by a number of my colleagues and involving investigators all around the world with data from over 730 sites in 43 countries. And they showed that more than a third of the heat-related deaths over recent decades attributed to human-induced climate change. So in other words, very unlikely to have happened in the absence of human-induced climate change. Now, if you look at the map, you see there are big grey areas. Well, the grey areas are where we don't have good data. So much of Africa, much of Asia. So the parts of the world we really want to know what's happening, we don't have that data, partly because vital registration systems don't exist. So, you know, we can't get the daily death data, for example, which you need in order to make these kind of analyses. So big gaps in the data, but what we know, and it's probably an underestimate, is that there are significant numbers of heat-related deaths occurring now as a result of climate change. Moving on to infectious diseases, some work from some of my colleagues at the school. This is a projection into the future, additional people at risk by 2100 due to climate change. And obviously it depends on where we are in 2100. And these are two perhaps rather extreme comparisons, but there's a 3.7 degrees centigrade, which probably is unlikely. I mean, at the moment, we seem to be heading somewhere between 2.5 and 3 degrees, but there's still uncertainties. And then compared with 1 degree, which also looks very unlikely because I don't think we can keep it down to 1 degree. We're already over 1 degree. But anyway, if you make these comparisons, you can see that there's a difference of perhaps a couple of billion people exposed to increased risk of these common vector-borne diseases. And we know that in the case of dengue, for example, the vector mosquitoes, the common vector mosquitoes, are already showing over recent decades an increased capacity to transmit dengue as a result of increasing temperatures. But we also, and this is not work done by us, but it's an interesting paper that came out in Nature at the end of last year, which I thought was really quite very interesting scientifically, looking at how, as the climate goes on, as the climate increases and temperatures increase, and also you get decreases in biodiversity, you kind of force together, you get limited areas of where biodiversity is maintained, and this forces together the humans with wildlife. And so there's a greater capacity, a greater tendency for the transmission of these emerging viral diseases as a result of this combined effect of biodiversity loss and climate change. And so, as you know, many of these zoonotic diseases arise from wildlife or domestic animals, or the interplay between wildlife, domestic animals, and humans. And that's where these emerging viral infections come from. And of course, they potentially can be very hazardous, very, very dangerous. And there are a range of these different emerging diseases. Obviously, COVID was an emerging viral disease. We still don't know. It's very hotly debated what the origins of COVID were, as you've probably seen in the press in the last few days. It's a very active debate. But what we do know from this modeling study is that the risk of these kind of conditions is likely to increase in years to come. And then food. This on the right side of this slide, you can just see the map shows you where the productivity of food crops is likely to decrease in coming decades. And you can see the red area, of course, covers much of the globe. Yeah, there may be temporary increases in the green areas. We don't know for how long, but as you can see, many of these, Ukraine, Russia are part of those, and we're already seeing the effects of massive disruption of the world's food system. So climate change interacts with these factors and increases the risk of food insecurity as the century goes on. And on the left, you can just see what the climate models, the climate crop models are projecting. You see it gets increasingly negative as the century goes on. The red and orange bits get bigger, which means there's more and more negative projections. So obviously very worrying and suggesting that we need to take a different tack to what we are at the moment, and that if we don't, we're headed for trouble. So I've mentioned physical health mainly, but I just want to mention mental health as well, because we're just understanding now how important mental health is. I mean, we understood that through COVID, of course, but also we see it in relation to climate change, because there are many mental health effects of these climatic events. We know that populations exposed to wildfires, exposed to floods, exposed to droughts, when you follow them up a year later, they have a high prevalence of common mental disorders like anxiety, depression, and that makes it more difficult to recover from these events, of course, as well. And there are also new concepts like solastalgia. Solastalgia is a distress which is experienced by environmental change. So when you see your familiar environment changing before your eyes, it's a very distressing experience. And if you're, for example, an Arctic village which has to relocate because of melting ice, that would be an example of a sort of triggering event which might trigger this kind of solastalgia. And then climate anxiety, which is quite a pervasive feeling, and particularly amongst young people. And I'm sure many of you have thought about it yourself, but this survey, which is on the right side of this slide, was really struck me. I wasn't involved at all in the study, but I thought it was a really interesting survey of young people around the world in quite diverse countries, as you can see, including countries like Nigeria and India and so on, but also high-income countries. And what's really striking is that about 45% of them felt that they had such a high level of climate anxiety that it was impacting their functioning, which was really quite alarming. And about 60% of them were either extremely or very worried about climate. And also, the other thing this study showed was that they had very limited faith in politicians to actually reduce the risk. So there's also a real lack of credibility of our political systems to address some of these burgeoning global issues. So that's obviously worrying in its own right. But there's also some evidence, it's not particularly good, but I think there is some evidence that getting more involved in climate action could be perhaps an antidote to some of these feelings of anxiety and so on. A feeling of engagement and involvement may help to offset some of these negative feelings. It's something we can come back to maybe in the discussion. So let me sort of conclude by saying, in a more positive frame, what do we actually need to do about it? And there are two types of actions we really need to take, I think. One is to adapt to the changes that we can't prevent by creating more resilient, for example, more resilient health systems, or better flood protection, better disaster management, upgrades of infrastructure and so on. And the second is around mitigation. Mitigation in this context, in the climate context and the environmental change context, means cutting emissions, cutting the drivers of climate change. And both are important. And in fact, we need to integrate the two types of approaches more. So the kind of disaster relief, disaster management would be a part of the adaptation spectrum of actions, and the mitigation is around clean energy, more sustainable food systems, more sustainable transport systems. And of course, I say we need to integrate the two because, for example, we could reduce heat loading by just putting air conditioning everywhere. But if we did that, that would have big implications for fossil fuel burning, of course. And also it can make communities quite vulnerable because often the electric grid fails, in a heat wave. It's not uncommon for the grid to fail because it becomes overloaded. And then the vulnerability obviously increases. And also the poor, the most disadvantaged, can't afford access to air conditioning. So we always need to be mindful of kind of adaptation actions, what implications they have for equity and also for mitigation as well. And mitigation, of course, brings many health benefits with it, as well as the benefits of reducing dangerous climate change. It also brings near-term benefits because clean energy is much less polluting, for example. More sustainable diets are also healthier diets. More sustainable transport systems are also healthier transport systems, and so on. So there are all these relatively near-term, often called co-benefits. We can debate whether that's a good term or not, but they're often called co-benefits because they're kind of ancillary to the main purpose, which is reducing the risk of climate change. So yeah, there's a lot of big benefits that can accrue from these mitigation actions from a range of different pathways. So this slide just gives you an indication of the sort of numbers of premature deaths that could be prevented, and it's a modelling study that was done a couple of years ago by some of my colleagues at UCL and at London School. And what they did was to look at across 9 countries. They modelled the impact of policies to achieve, be consistent with the nationally determined contributions. You may know that NDCs are, these nationally determined contributions are the submissions that every country who signs up to the Paris Agreement has to make, and or should make anyway. And so they specify what kind of ambition, what kind of climate ambition this country has. And often health is neglected in these NDCs. And so this modeling study looked at what would happen if these countries prioritized health. And they suggested that you could prevent potentially millions of premature deaths, again, over and above the deaths prevented from climate change, from reduced air pollution, clean energy, diet-related risk factors, and physical inactivity. And as we know, that many people in the modern world are physically inactive, and the best way to get them moving is of course, walking and cycling, using public transport for everyday activities. And you can see if you add them all up, they add up to millions of premature deaths averted. So moving on, what sort of urban policies can be put in place? We know that the growing percentage of the world's population lives in cities. Population growth is really an urban phenomenon now. And these are some of the policies that can be put in place to create more resilient cities, but also to reduce greenhouse gas emissions. And many of them I've already mentioned. But perhaps I'll pick out this one here, safe access to green spaces and ecosystem strategies for resilience. We are becoming aware that many of these strategies bring health benefits as well as environmental benefits. So green space helps to reduce the urban heat island, for example. It helps to cool cities. We know that cities are generally hotter than the surrounding country, so it's called the urban heat island. But green space helps to reduce that the heat of experienced in cities. And we also know that there are physical and mental health benefits of being exposed to green space, particularly to adults and probably to children as well. And then, of course, housing improvements, water and sanitation are well known to improve human health. And if they're well designed, they can also help us to adapt to and to mitigate climate change through clean household energy, for example, less black carbon emitted, pollutants, probably less gender-based violence because women don't have to walk for hours to pick up wood and so on. There are all sorts of benefits from clean energy. And then the healthcare system itself, we're realizing now that the healthcare system is quite a major contributor to pollution and of course to climate change. So if it was a country, the global healthcare sector would be the 5th largest emitter on the planet. It's responsible for about 4 to 5% of emissions. In the US, the health system is responsible for even more, probably between 8 and 9% of emissions, because the US healthcare system is very, very energy hungry and uses vast amounts of resources. And we now have this new alliance set up by WHO called ATTACH, the Alliance for Transformative Action on Climate and Health, which is supported by more than 60 countries. And these are countries which are committed to reducing the environmental impact of their healthcare system, but also making them more resilient to climate shocks, floods, droughts, and so on. And through heat wave early warning systems, disease early warning systems, so on. And some of these, about 14 countries, have set a deadline by which their health system will reach net zero emissions. Not enough, but some have done so. Interesting enough, these emissions come not just from the energy costs of the buildings, but a lot of them come from supply chains. So it comes from the pharmaceuticals, because they're very energy hungry. from medical equipment, from transport, even food that's consumed in hospitals and health facilities. They all have their own planet greenhouse gas footprint. So there's a lot of work going on now, strategies to decarbonize the healthcare system, mainly in high-income countries, but also some in low-income countries too. So the Aga Khan Foundation, for example, has been working a lot, developing much more energy efficient, less polluting healthcare facilities in a range of countries, low-income countries. So in summary, what we can say is that humanity is really faced with unprecedented risks. That the progress we have seen, the very inequitable, admittedly very inequitable progress that we have seen in recent decades is really going to be increasingly undermined by the environmental trends that we're witnessing right now. And that policies we're putting in place are just completely insufficient to address the scope and scale of the challenge. So we really do need to redefine what we mean by human progress. And that can't just be based on GDP growth, because we know that's a very important, very poor indicator of human progress, but also it's driving a lot of the increase in emissions as well. So we need to rethink what we mean by development, what we're trying to really achieve. And in our Planetary Health Commission, we suggested that this idea of sustaining human health within planetary boundaries, human health and equity, could be a useful framework for conceptualizing some of the sort of policies that we need to see in the modern world in order to bring us back on track. So when we suggested thinking about how to redefine prosperity for our current age, which, as you know, has been called the Anthropocene epoch, because it's called Anthropocene because the changes are driven by the activities, of course, of our species, the inequitable activities. So we have this big choice, in a way, which is seen transformation to a much more sustainable world economy, or business as usual. Business as usual will lead us to, I'm afraid, to disaster. We do need to rethink our whole development approach. And of course, at the moment, many of our societies are not equipped to do that. We don't have the necessary political leadership, sadly. There are a few economies that are beginning to think in those terms. There's a group called the Wellbeing Economies Alliance, which some of you may have come across, which is an interesting group of countries that are trying to reconceptualize what it means by human progress and what they want to achieve. But it's still a fairly small group. And there's a lot of interesting work going on at the city level, some visionary city leaders that are also trying to turn around their cities. But at the moment, the scope and scale of all this work is really just completely inadequate for the really extent of the problems that confront us. So what I would say to you is there's a lot that we know. We know a lot about what to do and sometimes even how to do it. What we're not making progress on is actually how to implement that change. And of course, there are a whole range of reasons for that we can come back to in the discussion, but there are many powerful forces which are completely obstructing the kind of changes that we need to make. So I think I'll stop there, but sort of throw it open to discussion, and hopefully at least I've triggered some thoughts in your mind, and you may wish to challenge me or quiz me or whatever on what I've said. I'd be very happy to respond. Thank you very much.
Thank you very much, Professor Haines. And before open up to the audience, I would like to ask one question, because from your presentation also it became very clear that that it's the poor communities are the most affected by the climate change and climate impacts.
Yeah.
However, in that, where do you see the voices of communities coming into policy making and policy implementation?
Well, I think the answer to that is not as much as they should be. I think there's an absolutely crucial place, because in the end, much action has to go on at the local level. Of course, we need national level change as well, but many of the changes will occur at the local level, whether it be adaptation or mitigation. So I think this is really a kind of a missing dimension in a lot of the policy dialogues. I do think there are some really interesting examples, and in fact, the person, my old friend here that I'm staying with, really is a great expert on communities. I wish he was speaking to you rather than me, and I will suggest that you invite her to speak at a future of your events, because one of your events really has unparalleled experience in working with communities and engaging indigenous groups, but also emphasizing the importance of local solutions to environmental change. So this is absolutely crucial. I think the question is how to mobilize that, and also the need to respect that community-based knowledge, which is often devalued. And I do believe now that the time is right for the scientific community also to embrace the importance of community action, that no research will never succeed if it's imposed on people. What we need to do, of course, is to co-design, work with those who are going to implement these actions, to co-design potential solutions there. And importantly, kind of evaluate the impact of them. So yes, absolutely crucial, the voice of community, but often overlooked because of the, well, partly I think because of the powerful interests that we know are often driving the global, which are sometimes suppressing these voices.
Thank you. Duncan, you got your hand raised.
Thank you, Andy, for the very informative presentation, which I guess is not, it's almost not so surprising, but I guess, you know, the question you alluded to and sort of mentioned, you know, how the sort of limited faith in politics and politicians. And I guess, I mean, I work in government, so that's sort of the first thing that flashes to my mind. And when one is briefing a minister, you know, the briefing is basically 3 key points, a page of background of what you want to get out of the meeting, and then you move on to the next thing. And the sort of sustainability of that engagement is so difficult when they are looking at, I'm a minister, I've got a political party, I go and represent Parliament, I've got a family. So how do you make, I guess my question is, if it's limited faith in politicians, which I don't disagree with, I guess my main question is there then an opportunity for academia globally to work either with communities, with individuals, to start influencing that dialogue a lot more heavily? You mentioned the Aga Khan Foundation, you know, which is a wonderful organization, really to underpin global engagement and to get, I guess, the politicians moving in the right direction, because this is now, I think, as you alluded, this is more about quality of life and not just about making more money and being more prosperity. So I guess the question is, you know, is there an opportunity to make academia and academics more influential across the political spectrum? And thanks very much once again.
Well, thank you. You know, and I do, you know, it's really important that people like you do work with political leaders, because there sometimes are openings that can be exploited, and it's all very easy for, you know, someone to come along and say we need to transform everything. But, you know, we also sort of, I have some sympathy with politicians, because in a sense they're also got to look over their shoulder at the next election and how they're going to win and maintain power. So of course I'm very skeptical about the current political system, but at the same time one does have to recognize that there are short-term imperatives, and that's why we've been trying to emphasize the near-term benefits of many of these policies by cataloging and quantifying, in our case, the health benefits, but there are others as well. It could be employment benefits and so on. So we're trying to make the case that policies need to try to achieve multiple benefits. One of the problems we've had at the moment is you often have a policy which has a very narrow focus. So for example, health, we just think, oh, well, we've got to spend more money on the NHS. Well, not necessarily, because many of the, I'm in favor of spending more money on the NHS, but we've also got to look at what the determinants of ill health are. And the determinants of ill health are social, economic, and environmental. And unless you also tackle those determinants of health, you'll constantly be trying to, you know, it's like putting your finger in a dike. You know, you're not going to be able to cope with the sheer volume of ill health, because we have a society which often creates, in a sense, ill health. And then we have a healthcare system which tries to deal with the consequences of that system. Now, in terms of, I do think we need to help politicians with the kind of near-term benefits and the credible things they could do, which would have multiple benefits, and also to communicate that much more effectively. So I think we in academia are not very good at communicating to the public. We tend to talk to our own disciplines. We have our own language. It's not very easy to, we don't communicate in a very clear way to the general public. So I think we need to be quite humble. I think that we need to understand much better how to, what are the day-to-day concerns of the public, and try to attune our message to the needs of the wants of the public and the political kind of establishment, accepting, of course, that many of the systems are hopelessly defective and will need to be reformed if we're going to tackle these problems of the Anthropocene more effectively, because our economy, of course, as we know, doesn't reflect the true costs of economic activities. So, when we burn fossil fuels, we don't pay the full economic costs. We don't pay the cost of the air pollution or the cost of climate change. Pay the cost of the petrol or the diesel at the pump. So, we need to move towards an economic system which reflects the real cost much more effectively. But also, as I've said, we need to have a public debate about what we really want to achieve. Given that we're going to, we live on a small planet, there's nothing we can do about that. Is there are profound inequities? What kind of society do we want to live in? I would like to see the political establishment leading some of that debate, but I don't see any signs of it. And I think it's perhaps a mistake to think that politicians are essentially leaders. I mean, they may be leaders of their parties, but they're not leaders, they're not thought leaders. And indeed, you could argue they couldn't really afford to be, because they will need to carry the population with them. So I don't think academia will achieve much by itself, but I think that working with other key players, decision makers at different levels, including those at the city level, who sometimes have a bit more flexibility, mobilizing the professions. And that's why my own profession in medicine, I think it's really rather heartening to see how the health professions are suddenly recognizing the impact of climate change on health and are standing up and saying, we need to do something. So we're getting different voices coming in, which is really, really helpful. We can't just blame politicians as individuals. We also have to, I think, have our own contribution to make in changing the kind of dialogue and the way in which we frame human progress, which is very limited at present. We could probably days and years debating it, but yeah.
So I had a quick question. Thank you so much, Professor Andy. And it's with regards to one of your slides, which showed that mitigation phase, which I thought was really interesting. My question is sort of really on, are there any sort of particular trade-offs that we're not sort of really looking at when we look at sort of electrical cars? So if we look at, for example, the copper mines in Zambia, for example, are we then, because of this sort of mitigation phase and sustainability, are we again reburdening communities because of our want to be sustainable? And
absolutely,
what are your thoughts?
I'm glad you brought that up, Claudia. It's absolutely crucial. If I'd have had, I would have gone into that much more, but I'm so glad you mentioned it, because I mean, most of these policies are beneficial, but some of them have major trade-offs. And I have quite big concerns about the whole emphasis on electric vehicles, particularly if we're going to, it's not possible to have a world population where everyone drives a Tesla. It isn't going to happen. And if it did, it would be a disaster. So, I think we need to focus more on demand management, because it's demand which is driving, rather than need, it's often demand which is driving many of these changes. So we need to be asking ourselves kind of needs from wants. And of course, wants are very much driven by the consumer economy, and they can be molded and shaped by our culture and by what we're told and the advertising industry and so on. So taking that example of transport, I accept that electric vehicles, if you're going to have vehicles, then electric vehicles are probably better than fossil fuel vehicles, but they come with a price. Again, you've mentioned batteries. We hope that battery technology will improve over time. We might need there might be different types of batteries, a lot of experimentation going on. But what we have at the moment is that the vast expansion may involve quite a lot more extractive industries. And as we know, extractive industries can have pretty negative impacts on the local population, depending on how they operate. So if you take, for example, cobalt mining in the DRC, in Democratic Republic of Congo, then certainly historically, we've seen a lot of informal labor, including child labor. Now, we do have guidelines now, we have the EU guidelines. I don't know how effectively they're being implemented. One of the problems we have is that many of these guidelines is they're good on paper, but they don't actually not implemented on the ground. So it'll be very interesting to see just how effective some of those guidelines are. But you're absolutely right. We need to think in a holistic way about what are the trade-offs of all these policies. And I think mass electrification does have some downsides as well as upsides. And we need to be very clear about what they are and make those transparent to the public and to the decision makers. Personally, what I favor is a transport strategy which emphasizes public transport, which I think is the way forward, because so much more efficient, of course. Also, because we know that most of the world population doesn't get enough exercise, the best way to get that on a population level is to get people using public transport or walking and cycling. And so walking, cycling, transport is the way forward rather than individual, rather than more car dependency, which I think is driving a lot of ill health. Also, we know that although you can abolish tailpipe emissions, if you have electric vehicles, you'll still have particles from tire wear and possibly brakes as well. And we're beginning to understand that some of those fine particles might also have a health impact. So I think there's a whole range of reasons why we need to look at systems approaches, not magic bullet like an electric car. It's the system you need to think about. How do you get people from A to B efficiently? And how do you, do that in a way which minimizes the environmental impact and maximizes the equity benefits? And that has to be public transport, walking and cycling. I can't see any other solution for that on a mass scale.
Thank you for that. And I think, for sort of our cohort in communities, just sort of on sort of that point, you also mentioned about being able to sort of uphold those traditional knowledge systems, which also come in that more sort of collective thinking. So that's, I think, a really sort of important merge where communities are sort of, I think, quite important in this debate. Thank you. I'll sort of lead on from Janica.
No, thank you very much. And are there any other questions from the audience?
Yes, I have one question.
Sure.
Thank you very much, Professor Andy. It's really nice and very interactive and really valuable ideas. So I have been noticing even in some green leaders of the world, they put their statement in the public media saying that we are too late to save this planet.
Yeah.
My question is, so what is your opinion or your perspective achieving results, sustainable goals by 2030? What is your opinion and what's your rationale behind it? Thank you.
Thank you, Germany. It depends what we're talking about. Of course, it's too late to prevent all the adverse effects of climate change. We're already experiencing them. On the other hand, it's not too late to do something, and it's not too late to possibly, still think there's a chance to reduce some of the worst effects of climate change. I know there's a book out in the last couple of days. There's a book which actually says that it is too late, and what we need to do is planetary palliation. So palliative care, not curative care. I don't really agree with that, because I've worked as a doctor, and you don't start palliative care too soon. You don't tell someone, hey, we're going to give up on you, we'll just do palliative care, when they've still got a chance of benefiting from treatment. And I think that's, I believe that we still do have a lot to play for. Whether we have 2 degrees global average temperature increase or 3 degrees will have a massive effect on human well-being and human survival. So I think that the fossil fuel industries would probably quite like us to say, oh, look, it's too late. Let's not do anything. Let's just carry on burning fossil fuels as we are now. Let's just carry on with this very high consumption consumer economy. So I think it's playing into the hands of those who want to block progress. And of course, we need to be concerned, but I don't think we should be completely defeatist, because that is exactly what those powerful interests, not all of them, of course, but there are different views, but some of them I'm sure would be delighted if we gave up and just said, okay, we will just have palliative care and we'll get on with our lives in the next few decades. I don't agree with that. I think we need to redouble our efforts. I would say that I can't say I'm optimistic, but on the other hand, I'm not without hope. I think there are all sorts of things that are happening that, are commendable, and we should support them. So I believe that now is the time. It's not the time to give up and to put our head in the sand, but the time is to redouble efforts, to work together with those who do want to make a change, to also try to influence those who are undecided. There are some people you'll never change their views, We shouldn't waste too much time on the kind of deniers and so on, but there's a whole group in the middle there that could go either way. And I think it's really important to reach out to some of those people to try to communicate better what we need to be doing. So no, I don't think it's too late to do anything useful. I think there's a lot that can be done, but it is too late to prevent all the adverse effects of climate and these other environmental changes because we're already experiencing them. And we have to be realistic about that. So we do have to adapt as best we can, but we have to do more than adapt. We have to actually address the root causes of these environmental changes.
So I think, is there any one last question anybody wants to bring up? Or okay, then I think we'll wind it up then. So Professor Haines, thank you very much for your valuable presentation and the wealth of knowledge and critical thinking you brought into this session. So on behalf of the MSc in International Humanitarian Affairs, we thank you very, very much for your time and your valuable presentation. Thank you very much.
Thank you for giving me the opportunity. Thank you.